Hello everyone, I am Rinki Langthasa, a student of 4th professional year from Lakhimpur College of Veterinary Science, Assam Agriculture University. And now I am going to discuss about Downer cow syndrome. Before we proceed further, this is a disclaimer that this presentation has been prepared to the best of abilities of the UG students of Lakhimpur College of Veterinary Science to provide as much as accurate information as possible. We do not, however, encourage people to use this information provided in the presentation for any scientific work without cross-verification of data. Further, the information provided in the presentation should not be used for treatment without consulting a registered practitioner. This is strictly for education purpose only and not for commercial use. This condition, the Downer cow syndrome, is also known as post-parturient recumbency. It has also been considered as a special form of parturient paresis. This condition refers to the inability of cattle to rise and stand for a period of at least 12 to 24 hours for undetermined reasons. Etiology. The actual causes leading to this condition are not clear. However, the following factors may cause the Downer cow syndrome. Persistent hypocalcemia. Milk fever cases which are unable to rise after 2 injections of calcium preparations indicate persistent hypocalcemic condition. This may also be due to incomplete dosage of calcium, inadequate intake of calcium through diet due to poor in appetite, or due to delayed treatment of milk fever cases. Persistent hypophosphatemia. It is one of the most common causes of Downer cow syndrome. The animals with low phosphorus levels show general weakness. Hypomagnesemia. Low level of serum magnesium is also seen, but it may develop along with hypocalcemia. Hypokalemia. Low serum potassium level is often seen in association with hypophosphatemia in Downer cow syndrome. Muscle injury. Muscle injury, particularly of abductor and gastrocnemius muscle of hind limbs, occur as a result of spreading of legs when cow attempts to rise following the treatment of hypocalcemia. Factors responsible of muscle injury are recumbency and obesity. Nerve injury. Usually, perineal and tibial nerve are damaged. Sometimes, pelvic nerves are also affected. The common causes of nerve injury are prolonged handling of dystocia and recumbency. Fracture of hip or limb bones or dislocation of joints may be due to falling down or spreading of legs due to slippery floor. Myocardosis is thought to be due to repeated dosing of calcium preparation. Hepatosis. It has been observed in fatty cow syndrome, which is known to occur in well-fed, highly obese cows during the advanced pregnancy. Toxemia may result from mastitis, acidic indigestion, metritis, etc. Epidemiology. Incidence. It is a sporadic disease. Species. Cows and buffaloes are affected. In case of breed, it is most common in exotic dairy breeds and crossbred Holstein Friesian cows, and only females are affected. Physiological status. It is most common in recently calved or advanced pregnant animals. Stage of lactation. The disease mostly occurs in the first 2 to 3 days after calving in heavy milk producers and many times as a complication of parturient paresis. Predisposing factors are obesity, light exercise, cold stress. Clinical findings. Downer cows are generally further categorized as either alert or non-alert depending on the clinical signs exhibited by the cows. Alert Downers. Animal is alert and bright. Appetite normal to slightly reduced. Temperature and heart rate are usually normal. Animal is usually in sternal recumbency and at initial stage tries to rise up. It results from milk fever and calving injuries. Non-alert downers. Animal is dull and depressed and does not take feed and water. There is inappetence to anorexia. All physiological parameters are abnormal. Eye mucous membrane may be congested. Animal is in lateral recumbency and usually does not make an attempt to rise. It results from septicemia, toxemia due to metritis, mastitis, TRP, indigestion. Diagnosis: history of milk fever, prolonged handling for dystocia, calving injury, and clinical signs such as recumbency for more than 24 hours may help in the diagnosis of this condition. Clinical pathology reveals low level of calcium, phosphorus, and potassium values, and high alanine aminotransaminase and creatinine phosphokinase levels. Treatment: treatment should be given as early as possible, immediately after exhibiting symptoms. If the recumbent condition prolongs more, death may occur. Recovery from Downer-Cows syndrome strongly depends on the quality of patient management and nursing care. Treatment is undertaken with medicines along with physiotherapy to correct the etiological factor. General care and management includes good nursing care and management, provision of soft bedding with hay or dry grass or paddy straw. Animals should be turned from side to side every 3 hours to minimize ischemic necrosis. Slinging for 15 to 20 minutes every 4 to 5 hours is advisable. Animals should be made to stand with support at least twice a day. Massaging of legs or limbs. Infrared therapy for 30 minutes twice daily till recovery, and provision of good quality hay. Sling support. Cow is assisted to stand for 15 to 20 minutes at least twice a day using supportive slings. The sling is designed in such a way that the weight of the animals could be equally distributed. Soft bedding materials for calf animals. Sand is used as a bedding material because cow would easily be rolled from one side to other side and for regular removal of excreta. Massaging of hind limbs with vegetable oil to increase muscular activities is carried out and hot water fomentation is performed. Therapeutic management includes parenteral preparations containing calcium, phosphorus, and magnesium at the rate 1.5 ml per kg body weight, slow IV for 1 or 2 occasions. Potassium acetate may be given at the rate 30 to 50 gram orally for 5 to 7 days. Use of muscle tonics and nerve tonics may also be helpful. Corticosteroids are recommended for treatment of Downer cows as they increase motor activity by increasing intracellular potassium content. Vitamin E and selenium preparations may be used. Antibiotics in case of infective cases should be used for 3 to 5 days. Recovery rates vary from 20 to 50%. Prognosis. Prognosis is frequently guarded and depends on cause of recumbency and duration of recumbency. Mortality ranges from 20 to 67%. Many die within 7 to 10 days due to sepsis or shock. 33% recovered between 3 to 30 days. Treatment may be continued if no obvious physical abnormalities, bright, eating, and continued attempts to rise. Lastly, the control strategies. Cows should not be mated with heavy wool to prevent dystocia. Cows should not be fed too much during advanced pregnancy to avoid obesity. Cows should be made to stand within short time following parturition. Periodical turning should be made in recumbent cows. Parenteral administration of vitamin D3 in milk fever-prone cows 1 week prior to parturition is helpful. Milk fever cases should be treated immediately. These are the references used in making of this video. Thank you for watching. Hope you like this video.